So what's on the agenda? We have some information on the background. I'm going to go through what is the same and what has changed for 2026. We are going to cover the sampling process and the support materials available to you. We may take a comfort break. We might just push straight through, seeing how everybody feels at that point. We will then cover your patient list and how you actually gather that, and include looking at potential sampling errors. We will then take you through how you submit that patient list to us, give you the important dates, tell you what your role is and what PICA's role will be during the course of this sampling period, and run through some of the FAQs that were asked, as well as having an opportunity at the end to ask free-form questions from you all. So thank you very much. In terms of the background then, overview, impact and importance of this. The National Cancer Patient Experience Survey has been designed to monitor national progress on cancer care, provide information to drive local quality improvements, and to assist commissioners and providers of cancer care, as well as inform work of various charities and stakeholder groups supporting cancer patients. It's currently a mixed mode survey, so that means it's available to complete online and via paper. The first survey was carried out in 2010 with a substantial overhaul in 2021. So 2026 will allow for up to 6 years of trend data for the majority of questions now. How do we go about doing this? We use Section 251. This survey has received Section 251 support from the HRA and their confidential advisory group, and from the Secretary of State for Health. This means that the common law duty of confidentiality has been lifted to allow confidential patient information to be disclosed for the purpose of carrying out the survey. So that means that you can, in fact, give us the data that we're asking for. There are further details on the CAG website, and you can have a look at approved non-research applications on the register there. What it means for you. Trusts, please do not submit any additional data variables other than the ones that we request from you. Please do submit those data variables that we do ask of you, though, of course. You must ensure that you have removed patients that have specifically opted out from this survey. I'll come back to that in a moment. And trusts should submit their patient list using our secure site only. Do not submit anything to us by email other than things that we ask you to. So definitely no patient data via email, thank you. To follow up on cases raised by PICA where participant alerts us they don't have cancer, we will need you to do that for us. And please do respond quickly to any cases raised. That's very important. It removes the potential for distress caused to patients, and it also has impacts on mailings and survey timings if there are delays in response. We will be keeping all the patient information that you send us totally confidential under secure servers that we have, and we will comply with all relevant data protection legislation. There will be checks for deceased patients before each mailing by submitting the list to DBS or equivalent services, and subsequently removing those people from any future mailings. We can remove patients that opt out via the free phone line or email, or by returning a blank questionnaire to us, for instance. And we will check all free text comments for any safeguarding concerns and escalate as necessary. We will follow up with trusts where a participant alerts us that they're not eligible due to not having cancer. And we'll come back to that one at a later point as well. And we will securely delete any patient identifiable information that we have 12 months after publication of all survey results. A note on the National Data Opt-out Programme. There is a thing called that, and it allows you to opt out of your confidential patient information being used for research and planning. However, National Cancer Patient Experience is exempt from the National Data Opt-out. So people would need to specifically opt out of the Cancer Patient Experience Survey. They cannot rely on being opted out of via the National Data Opt-out Programme. So all eligible patients are to be included in the patient list, please, unless they have specifically requested their details are not used following sight of the survey pre-publicity, i.e. having displayed dissent posters and then contacted you directly to say they don't want to be involved. What's the same and what's changed for the survey this year then? So unchanged for 2026, the sample period is exactly the same. Eligibility criteria are the same. ICD-10 or ICD-11 codes are accepted for diagnostics, and we will still be using our secure sample checking platform for uploading of patient sample lists. The survey methodology in terms of the field work is the same. We're having 3 mailings with an option to complete online. This suite of outputs at Trust, Alliance and ICB levels will still be provided to allow for comparisons. We will be continuing with the collection of email addresses in the patient list. We will not be contacting patients by email. Trend data, we will be able to compare up to the last 6 years. What has changed then? The inclusion of mobile phone numbers is now mandatory in your patient lists, please. Additional checks are going to be used to check the accuracy of those mobile numbers, and you'll need to include valid mobile numbers, please, and exclude landline numbers. So valid mobile numbers are 11 digits with 07 at the start, or I think that should be 13 digit with plus 44 7. No, it might be, yeah, okay. Is indeed 12, sorry. Eligible patients should be included in the sample whether or not they have a phone number. Don't include patient numbers for those who have explicitly dissented to the use of their mobile phone number, and don't include patient numbers if there is a note specifying that the number belongs to somebody other than the patient, such as the carer or family member. However, it is fine to provide a work mobile if that is noted. All of this is to ensure that we have better understanding of coverage of mobiles across trusts, and we will not be contacting patients by text message in 2026. Also changed for 2026, the data sharing agreement. It is valid for 5 years. It is a multi-year agreement, but there are a few updates that have been made this year, and so we have already contacted you to do this. If you have not filled in your data sharing agreement, please do so, or get in touch with us if you cannot find how to do that. But that has been issued, and we do need that in place before we can do the next steps. Also changed for 2026, there are a few questionnaire changes. It will be published in August on the website once we have finalised it. There are planned 2 small changes this year. One is on question 64, which is which of the following best describes you. That is likely to be updated, and the wording is currently TBC. And the other one is question 2. We are planning to update the response options here to align with Jess's rule. So rather than having 3 or 4 times as a response option, we now have separate categories, 3 times and 4 times, to answer the question before you were diagnosed, how many times did you speak to a healthcare professional at your GP practice about health problems caused by cancer? And we can investigate to see what impact that has on trend. That is it from me, and it's handing over to Caroline now.
Thanks, AJ. So, hi everyone. I'm Caroline, the Research Associate on the NCPES team. So I'm going to talk to you about the sampling process and the support materials that are available and how you could use them. So first, to start off, this is just a basic overview of the sampling process. All the materials can be found on the NCPES website, which is at the bottom there on the survey instructions page. So as AJ mentioned, the process starts with the dissent posters that we ask you to display at the beginning of the year and recording any patients that dissent. Then we ask you to compile a list of eligible patients, to then validate that sample and perform some checks on it, remove deceased patients. Then we ask you to fill out the data sharing agreement, and then once we have that agreement in place, we're able to obviously share data. Then once you have your sample ready, you'll complete your declaration form, which is available on the website, submit that to us via our email address. Then we'll review it, and if it's correct and then we've accepted it, we'll give you access to the online sample checker, which you can then log on to and submit your sample. And then we request that you be available for up to 2 weeks after you submit to answer any questions that we might have about the sample, because the sample checker, for those of you who've done this before, often flags a few things, historical checks where we need you to provide explanations for some things, and so it would be really helpful if someone who was involved or can help answer those questions can be around after submission, because what has happened in the past is that on a Friday evening. Someone will submit it, then they'll go and leave because it's the summer. Yeah, a lot of people have leave planned. Will then be on leave for 2 weeks, and then we can't get an answer for a really long time. And it delays the final sample being produced, which then might delay mailings. So if not yourself, if someone in your team could be available to answer any queries that we have once you've submitted, that would be wonderful. So in terms of the guidance materials and what you have, so there are the dissent posters, which we've spoken about. There's the sampling instructions, survey handbook, the patient sample list template, the declaration form, and the platform user guide. So again, those are all on the website, and that's where they're all available. There is also the data sharing agreement, which has been shared via email. There's a link that you go onto, and then you just pop your details in there online, and then it's automatically signed. You get sent a signed copy, we get sent a signed copy. So that is that. But the dissent poster, I think AJ covered all the important bits. It's related to the section 251. You displayed it in March and for the remainder of the year, and made a list of people who have opted out and make sure that those people are removed from your sample. And next we have the data sharing agreement. So again, I spoke about this. It's an online link. If you haven't received this or don't know what I'm talking about, please send us an email to the NCPES inbox and we'll make sure that you get that link. But the deadline was at the end of July, so anyone at this point who hasn't completed it, please do so that you can, in fact, submit your sample. Then the other two materials that are useful to have is the survey handbook, which just provides an overview of the survey, why we perform it, and those kinds of details. And then the sampling guidance, which will be the most relevant to you, tells you exactly how to draw your sample and the exclusion and exclusion criteria, which I'll go into a bit more detail later. But everything that I'm going to talk about is in this document in a lot more detail. Then there is also the Excel template, which you can download from the website. This is the exact format that we need for you to put the information in so that it can be accepted by the sample checker when you upload it on there. Then the declaration form, which I spoke about earlier, once you've compiled your sample, you then have to complete the declaration form and send it to us. And then once we've approved it, we can give you access to the sample checker. We also prefer that there's not a huge gap between your declaration form and submitting your sample, because if you've made some changes to your sample in that time, we can't guarantee that everything in the declaration form is accurate. But Rasheen can go into a bit more detail about that later. And the final document that you can get from the website is the sample checker user guide. So this is just a how-to document of how the online sample checker works, how to upload things, how to log on, and then it also has quite detailed explanations about the different checks that you can get. So the errors, queries that pop up, what they mean, how to fix them, or not, maybe not how exactly to fix them, but what they mean, so you can get an idea of how to fix them, as well as any historic checks or notice queries and that kind of thing. So next I am going to chat about the patient list. So basically drawing your sample. So I'm just going to cover the eligibility criteria. So first of all, who do you include? So please include patients who've been discharged between the 1st of April and the 30th of June 2026. So these patients have to have a confirmed primary diagnosis of cancer, and they have to have been admitted as an inpatient or a day case for cancer-related treatment. I'll go into a bit more detail about what cancer-related treatment can mean. Also, please make sure that they were discharged during the sampling timeframe, the dates above. Make sure that they are 16 years older at the time that they were discharged. So even if they were admitted when they were 15, they had their birthday and they turned 16 and then were discharged, please include those patients. Then we also ask that you please include duplicate records, because we perform our own deduplication process, because sometimes a patient will have received treatment in multiple hospitals. So also sometimes a person may be admitted multiple times over this period. So please also include every instance of their admittance and discharge. And the potential sampling errors that we often have every year. So to try and avoid these, can you please only include patients during the sampling period, And please ensure that emergency admissions are included as well, and include all eligible patients, not just those who are newly diagnosed, but all patients who've relieved any kind of cancer-related care. We also ask that you please include patients with an ICD-10 code of D05. And who to exclude. So please exclude patients who are deceased, patients who have gone to a private hospital and not an NHS hospital. Exclude patients that are current inpatients, and exclude patients that are solely treated as outpatients. And please don't include anyone if they don't have a UK postal address, because we only post people within the UK. So we ask that you please exclude people who don't have a UK postal address, as well as people who don't have enough information in terms of their address. If you don't have enough information on their address and we can't post them the letter, then please don't include them. And also please exclude people who've opted out from taking the survey as a result of seeing the dissent poster. And then we also ask that you please don't include anyone who has a holding diagnosis or are waiting for test results. Because we don't, they need to have a confirmed case of cancer before they're included. We also ask that you exclude people with a patient classification of 5, and that you please exclude people with an ICD-10 code of C44. And the corresponding ICD-11 codes, or ICD-10 code of C84 and the corresponding ICD-11 codes there. So some of the errors that we receive a lot, so please don't include patients who were solely treated as outpatients, and then also patients with an ICD-10 code of C44, C84, and cancer patients that have been seen at the trust but not for cancer-related treatment. And then something else that we've also noted over the years is please only exclude people if they don't meet the sampling criteria. So we've had instances in the past where trusts have excluded people because English isn't their first language, or because they have made a complaint against the trust or something like that. So those aren't reasons that we would like you to exclude them. So please still include those patients. Then moving on to cancer-related treatment and what this actually means. So cancer-related treatment, on the whole, what counts as that is up to you as the trust to decide what that means, but we're very happy to help you in that decision. So if there's any situation where you're not sure, please feel free to contact us and we can help you decide. But examples of what counts as cancer-related treatment, so all forms of chemotherapy, radiotherapy, and those kinds of things that are up on the slide here, as well as treatments for cancer-related anemia, and anything else that's directly related to treatments for cancer. But an example of what wouldn't be considered cancer-related care is if someone, for example, had breast cancer and they are in remission and they had breast cancer several years ago and now they've come back for reconstruction surgery. That wouldn't, under our definitions, be considered cancer-related care. But again, if you're not sure, please reach out to us at the NCPES. You can either call us or reach out to us by email and we can help you decide on that if you're not completely sure. Then I mentioned earlier to not include outpatients. So I know that a lot of people have a lot of questions around this every year. So we currently NCPES excludes patients who only seen as outpatient appointments during this period, but we have put a lot of work in, particularly NHS England, with support from the Cancer Advisory Group, exploring options on including outpatients or not. And we haven't really found a solution that works yet. And in order for a solution to be accepted and be included as part of the sampling, it has to meet 4 different criteria. So it has to be timely, accurate, consistent, and low burden. So it needs, until we come up with a solution that meets those 4 criteria, we're not able to include outpatients. But there is a statement that NHS England have put out that is available on the CPES website, and you can find out more about the reasoning and the decision and what's gone into it if you're interested in that. So one of the final things I'm going to talk about before handing over to Roisin is the implications of sampling errors. So we are very strict, and during your submission process, there will be quite a bit of back and forth between someone from our team and the person who submitted the sample about the patient list, and we're trying to pick up as many errors as possible during this period. So this is also why we do this, is basically because we want the most accurate data as possible, and we want to avoid errors that we know to happen. And also this can help you in the future with any errors that might come up in the future, but it also helps us if we pick up all the errors as quickly, and if you respond as quickly as possible and we get it all sorted and signed off as quickly as possible, we then won't have any delays in the survey. And other errors that can happen if the sample, there are a lot of errors in it, it can lead to poor quality data. So to avoid that as much as possible. So depending on errors in your, so if we don't pick it up during this period and there is an error in your sample, it can have an impact on the historical data comparisons of your survey. So you'll see in all your reports that you'll have the 2026 data, but it won't be able to be compared with any of the previous data. So you won't be able to compare it with, you won't have any of those historical comparisons, which are always really useful to have. So to avoid that, yeah, we just need to make sure that the samples are as accurate as possible. And then finally, I just wanted to go into a bit more detail about no cancer cases, or what we call no cancer cases. So this is when someone will contact us through the helpline saying that they received a questionnaire, but they don't have cancer, and they are usually quite panicked about why they've received this questionnaire. So when this happens, we will contact you. We'll contact the trust immediately, and we'll let you know that you have a case of no cancer, and then we will give you the PRN number so that you can then get the details for that person. And then we ask that you please contact that, well, first of all, investigate why this person was included in the sample list, and then let us know the reason, and then to contact this person and let them know, again, why they received the survey and anything medically relevant to them. So if we receive more than one call from someone saying that they don't have cancer from the same trust, we then pause that trust's mailings, and we don't continue their mailings until you've given us a reason that we can be sure that your sample isn't incorrect. So in order to avoid any mailing issues for your trust, please respond to these as quickly as possible. Not just for us in terms of a process thing, but I think it's quite distressing for the people involved. So yeah, that is it for me, and I'm now going to hand over to Roisin, who's going to talk you through submitting your sample.
Hi, so my name is Roisin. I'm one of the program administrators. You have probably received an email from me at some point, and I'll be contacting a lot of you over the sampling period regarding the samples. So the first step to submitting your patient list is, as mentioned, the data sharing agreement. There was a reminder that went out for anybody who hasn't yet submitted theirs. We're more than happy to kind of help if you have any queries around that. Please do just send us an email. Once your sample list is ready, you can submit your declaration form, and then after that's been approved, we'll give you access to the sample platform to submit your sample. So the declaration form needs to be signed. It's a checklist to say how you've drawn your sample. It needs to be, if I could just get the next slide, please. It needs to be signed by somebody. This is just a confirmation that your sample has been drawn according to the sampling criteria. You've included and excluded the right people, and just some extra information about your trust or the sample that we might need. It can be signed by whoever you deem most appropriate. Usually this is the person who's drawn the sample or validated the sample, but some trusts like to have it signed by the Caldecott Guardian if they want that extra level of check. whoever you deem appropriate is absolutely fine. We just need it signed. One thing we'll say about this, please make sure that your trust name is the full trust name. That's really helpful. If you pop an abbreviation on, we don't always know which trust that is. So if you could pop the full trust name on the declaration form, that's incredibly helpful to us. Thank you. Next one. So the purpose of the declaration form is a checklist. There's a guidance tab, a checklist tab, and a sign-off tab. The checklist tab just says that the sample's been drawn correctly. It includes everything that might be involved in your sample. We do have a section at the top for any changes that have happened to your trust. That's really helpful. Anything like merges, or if a site has closed, or the way that you do one of the treatments has changed, just kind of anything that's relevant to the sample or the treatment is really useful. So we'd appreciate it if you could fill in that. There are some options that are numbers. There are 3 rows that are a number rather than just a check. If you could pop the number in those rows, it's quite obvious which ones they are. And anything that you've popped an NA next to, if it's not applicable, if we could just have a little explanation just to tell us why, that's really helpful as well. Thank you. On the declaration form, there is 1 row that has a pop-up box. Basically, this is around the number of dissenting patients. So as mentioned previously, you will have displayed the dissent posters in over the sampling period in hospitals, and anybody who has dissented from seeing those posters and has been removed from the sample because of that, just pop the number of those patients in the box. The reason the pop-up exists is because of the national opt-out data. So we have had historically, sometimes trusts will put a very large number in that, and we just need to clarify that you have not included people from the national opt-out because this survey is exempt. So that's just why that one exists. And there is a removals following validation check. So if you have removed people during the validation process by the clinical team, if you could pop how many rough numbers, even if you don't have a complete total, in that box, and any reasons for why those patients have been removed is really helpful for us. Thank you. So the patient list, the template spreadsheet is available on the online sample checker, and it's available on the website. One thing I will say with this is if you could leave both of those headers in, there's a row of the headings, and then there is also a row that is examples of things that or explanations about what each column is. Leave both of those in when you submit, because the sample checker is set up to ignore that information. That's really helpful, thank you. So submitting your patient list. So once you've submitted your declaration form to us, we will review it. If we have any queries or questions, we'll get back to you. It might be that we need you to resubmit the declaration form, or there might be some things that we've got a query about. Once that's been approved, we will give you access to the sample checker platform, and we will send you an email with all of your logon details. This is the logon page. The rough kind of process is that you submit your sample. The sample checker will throw up some errors or some queries. You'll resolve those, and then you can submit. There is a button that says submit to picker. If you have not clicked that button, we don't get notified that your sample is there, so we won't look at it. So please make sure you do hit the submit button. Occasionally, if there is an error that is outstanding, then you may not be able to submit. That's absolutely fine. If you send us an email, tell us that your sample is uploaded and where you've got to, then we can go in and have a look at it anyway. That's fine, but we won't know to have a look unless you've told us. So that's really helpful, thank you. We'll do our review and then might ask for some further explanations, might not, and we'll get approval. So when you submit your patient list, there are four types of queries that pop up. The first one is error. You cannot submit until these are resolved. These are things like your PRNs don't have your trust code in, something that we can't accept. If there are any that you can't resolve, please do add an explanation, and then, like I said, email us. The next level are checks. So these are things that we might be incorrect, might need to be resolved, but also could be correct. We just need an explanation. So sometimes things like if there are no mobile phone numbers available for a patient, the sample checker will flag that and say you don't have mobile numbers for these people. If the records don't exist for those, absolutely fine. Just pop that as a little explanations box. Just say we don't currently hold mobile numbers for these patients. That's absolutely fine. Some of them might be errors that can be resolved with resubmission, but yeah, if they can't be resolved, an explanation is perfect. There are then historical differences. This is the one that trips most people up. So the sample checker flags your current sample to your last year's sample and previous, and says if there is any historical difference greater than 5%. So if your sample size has changed by 5% or more, then it will flag that. For every historical difference, we need an explanation. We need something popped in the explanations box to say what might be going on. Some of this will be due to natural variation in the sample. We understand a few percentage shift of gender or age is completely understandable and is just the demographic of that sample. Sometimes there is another reason. Things like a hospital site has closed, so the differences in patients seen at that site will be obviously nil this year, or if there's changes to classification of treatment and whether patients are treated as day case, that could have a or inpatients, that could have a big difference. Yes, so any information around what's happening with those is really, really helpful. And this is the thing that usually we end up in quite a bit of conversation about. So that would be really useful to look at. Thank you. And then notices just give you some information. You don't need to do anything with them. It just tells you some stuff. Perfect. Just a note, please add us to your safe sender list. We will be emailing you from the email address on screen. It will always come from that email address. So if that one is added to safe sender, you'll get all of our queries. Perfect. And then there are some dates coming up that are important. So as mentioned, the deadline for the data sharing agreement has passed. Get in contact with us if you have any questions. If you know it's not completed, please do that as soon as possible. We also need cover letter signatory information. So when we send out the cover letter to patients, we pop the signatory of somebody from your trust on there. There are a few trusts that have yet to let us know who they'd like us to put on that letter. If you could do that as soon as possible, if that's not completed, that would be really helpful. From Monday, you can start submitting your samples. You can start sending us your declaration forms, and we'll get access to the sample checker as soon as possible. If we've not heard from you at all over the sampling period regarding your declaration form or your sample by the 26th of August, NHS England are going to contact everyone just to sort of check that you're happy with the sampling process and that you don't need any extra help. And then the 4th of September is the last day for submission. As we mentioned, the sampling and reviewing the samples can take a little while. So that's the last day for you to actually just submit your sample to us. And then the 14th of September is the deadline for us signing off and finalising those samples. So though that can take a little while, that can take up to 2 weeks, depending on the queries. So the earlier the better, and we'll be able to get back to you quicker. Just a note to say that all of these dates have shifted a week earlier compared to last year. This is just to ensure that we have enough time to adequately review the samples before we get to the mailing dates. And just a note to say that if you have annual leave or absences coming up, if you could have a think around how that might affect sampling. And if somebody's going on, as my colleague Caroline mentioned, if somebody's going on leave, can there be somebody else around to kind of answer queries? Because you know, if we're waiting 2 weeks and then someone comes back, we don't want to kind of drag the process out any longer than necessary. That's really helpful. Thank you. So just to talk a little bit about the roles over the sampling period, your role as trusts is to ensure that items are signed or delivered to us on time, declaration forms are completed, sample is drawn correctly and submitted. During field work, the no cancer case, cases of no cancer are the important thing, and we ask that somebody be around in order to respond to those if necessary. Compiling your sample correctly and also reviewing it, so the validation of the sample is really important as well by the clinical team. And pickers roles. So we will make sure you have all of the relevant data, all of the relevant documents, the data sharing agreement, the declaration form, etc. We will check your patient list within 4 working days of it being submitted. Like I said, if you can't hit that submit button or it doesn't appear, please do let us know and we can go in and have a look. We don't want you waiting on us longer than necessary. And we follow up on emails within 2 working days. Even if we don't have an answer, we'll at least respond to your message. Please do be aware it is a very busy time, so it might be towards the end of those 2 days, but that's how we will respond. And then after we've the sample's been approved, we take on the role of deduplicating. So like my colleague mentioned, leave duplicates in, we will deduplicate and run a DBS, ensure that the sample list is correct. We'll handle all of the mailing and the posting. We also support patients through the sample, through the field work if they wish to be withdrawn or they have queries. We'll raise any no cancer cases with you immediately, and then we do the data capture and analysis afterwards. Just to reiterate with the no cancer cases, it is important that they are responded or investigated as quickly as possible, because we don't want to have to pause mailings, and any unresolved, you know, if we have more than one unresolved case, your mailings will get paused. Yeah, so that's just like the important part of fieldwork. Brilliant, and I think I'm handing back to AJ for the FAQs.
Thank you very much, Rasheen. FAQs, have a number of repeated questions, so we'll run through a few of these before then opening up to the floor for any other questions that you might have. Some of this we have already covered in the presentation, but it's good to have a reminder. And as I say, all of this is going to be in the slide deck, so you will have a copy and record of this. So a reminder, the NCPES survey is exempt from the National Data Opt-out Programme. However, if somebody has indicated through seeing the survey communications, the dissent posters, they don't want to take part, then please exclude them from the sample. We have guidance for call and email handlers to instruct patients that they would only be opted out of this year's NCPES survey and would need to contact trusts for opt-out of wider surveys. So opting out of NCPES 26 only opts you out of NCPES 26, not anything else. In terms of the data sharing agreement, as covered, it should be signed by whoever you consider most appropriate for it to do so. Could be the survey lead, could be Caldecott Guardian, could be chief executive, whatever is easiest and best for you. We just need a signature of someone relevant. You don't need Caldecott Guardian clearance for the declaration form or for the data sharing agreement. They are not required to sign those off, or the transfer of data, because that is all covered in the data sharing agreement. We will be requesting DBS checks on our side, but you are required to a local check only for the initial patient list submission, please. We'll do the checks before each mailing. If you wish to do any other local checks during fieldwork, we're not going to say no to that. Please do let us know if you have done it and if there are anybody that we need to exclude as a consequence. The mailing dates that we'll be using will be sent out once they're confirmed. That's going to be in the next short while. We're just looking at the final methodologies around exactly what we're going to be doing for postage, for instance, there. Please do not exclude patients who have dementia. Please only exclude those people who are specifically excluded in the patient guidance materials. Dementia patients should be included as long as they meet all other eligibility criteria. As I said, it's important there to allow them an opportunity to provide feedback. Why are C44 and 84 excluded? And why are outpatients excluded? Historically, we've had issues here around people not believing they have cancer, for instance, and a high volume of free phone calls. And you've heard reasons around why outpatients are excluded as well. We need to ensure that we have good comparability between years and also within a year between each of the organisations taking part. Please exclude patients who were only seen from diagnostic tests, as there's greater risk of them having not yet received a diagnosis. So we want patients who have confirmed diagnosis only, please. And people receiving systematic anti-cancer therapy as an outpatient should not be included. Outpatients are excluded from the survey, as we said. You can include people from Northern Ireland, Scotland and Wales, provided they meet all other eligibility criteria and were seen, by yourselves in England, essentially. However, if they're without a UK address, then they should be excluded. So Republic of Ireland, for instance, would not be included, nor would the Isle of Man, nor the Guernsey and Jersey and so forth. So only UK residents. Each patient will only get one questionnaire. We do the deduplication of that. We keep the record with the most recent treatment discharge date and use that as our reference. And so patients will be asked to think about the hospital at which they had their most recent discharge during the period. Please include patients without an NHS number, provided they meet all other eligibility criteria. For both email and mobile phone, if you don't have an email or mobile phone number for the person, please do include the person, and please just give as much detail as you can for the email and mobile phone records. Essentially, we're collecting them now for the same reason. We're gaining insight as to what is around in terms of coverage and exploring the feasibility of whether we'll be able to contact via either of those methods. Please do check that the mobile numbers are indeed mobile numbers. So starting with a 07 or a +447, please. We've said we will be running DBS checks, so you should please include patients who cannot be traced against the national spine in DBS checks. We will remove anybody who cannot be traced. There are provisions for people whose language isn't English as the first languages. We have translation services offered by a free phone provider, and the online survey is available in 3 additional languages, being Polish, Bengali and Punjabi. The new survey website has a translated section as well, communicating survey information to patients. Patients can be sent subsequent surveys as a result of their answers to this survey, but only if they tick yes to a follow-up question in the questionnaire. So yes to being sent survey in the future about health and healthcare. Then they could be contacted about follow-up question from other research organisations that have requested and been approved by NHS England to use that data. If they tick no, then the data won't be used in that way. Publication is expected by summer 2027 for 2026 survey. And that is it for the FAQ section. And just to note that if you have any further questions that are not answered here and in the remaining part of this session, then please do email us at the email address on screen.